Hi, I'm Cynthia Belliveau. I'm a faculty member here and also an administrator and one of the planners of this sensational summit. And I'm here I have the pleasure of introducing Dr. Patricia Prelock. I call her Patty. Patty is the Dean of the College of Nursing and Health Science, Professor of Communication Science and Disorders, and Professor of Pediatrics in the College of Medicine at the University of Vermont. She coordinates parent training programs designed for caregivers of children on the autism spectrum. Very, very important work. And she will be introducing Nick in a few minutes. There's just one housekeeping item that I needed to tell you, and that is if anybody's lost a black iPhone, it is back at the desk. My honor to introduce Patricia.
Good afternoon. It's great to be here and to be sharing such exciting information with my colleagues, and I'm learning a lot over these last couple of days. In 1948, the World Health Organization described health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. As we think about the third theme identified as a focus for this summit, how social factors affect what and how we eat, it is most fortunate that we have the opportunity to learn from our next keynote speaker. And as we prepare for what we are about to hear, it makes sense to ask a few questions, like, what do we know about the human ability to change our behavior, to proactively adapt? How do cultural values influence food practice? Gwendolyn Brooks tells us that good health is a duty to yourself, to your contemporaries, to your inheritors, and to the progress of the world. So let me talk to you a little bit about our last keynote speaker, Dr. Nicholas Freudenberg. His talk, Choice, Responsibility, and Health, What is the Role for the Food Movement, fits well with our theme that considers behavior and culture. Dr. Freudenberg is a distinguished professor of public health at City University of New York School of Public Health at Hunter College. He also directs the New York City Food Policy Center at Hunter College, which develops intersectorial, innovative, and evidence-based solutions to preventing diet-related diseases and promoting food security in New York and other cities. The center works with policymakers, community organizations, advocates, and the public to create healthier, more sustainable food environments and to use food to promote community and economic development. For more than 30 years, Dr. Freudenberg has worked with community organizations, governmental agencies, schools, and churches to develop, implement, and evaluate programs and policies that improve health and reduce health inequalities in New York City and elsewhere. His work has been supported by the National Institutes of Health, the Centers for Disease Control, the New York City Department of Health and Mental Hygiene, the Robert Wood Johnson Foundation, and several other private funders. Dr. Freudenberg has published more than 120 scientific papers and written or edited 5 books. His most recent book, Lethal but Legal: Corporations, Consumption, and Protecting Public Health, examines the role of food, alcohol, tobacco, firearms, pharmaceuticals, and automobile industries in contributing to global epidemics of chronic diseases and injuries. It also analyzes campaigns to change harmful corporate practices and suggest a policy agenda for strengthening public health protection. We actually will be selling this book in the back of the ballroom at the break at 2 o'clock, right in front of the green signs in the back. So it sounds like a must read for many of us. So please join me in welcoming Dr. Nick Freudenberg.
So it's an honor to be here, and I wanted to begin by thanking the previous keynote speakers, Roz and Eric, and also the the panelists of yesterday afternoon and today, and I think they've really set a high level for discussion. I particularly wanted to thank you, Eric. You were really on fire this morning, and you've set a high standard for me, and I'll try and live up to it in this after lunch, end of the second day session. My contribution will be to add to the lens that Roz used, the environmental lens, and the lens of politics and economics that Eric used, to bring the health lens into looking at this problem of food systems and some of the problems we're facing in this state, country, and world. And the hope is that by putting these three lenses together, we can construct both a microscope that will let us look up close at some of the problems and a telescope that will let us take the distance. And that by doing so, we might be able to find the paths to the solutions to some of the problems we've been talking about to here. My charge for this session is to talk about the role of culture and behavior in food systems. As a public health professional, my goal is to get people to eat more fruits and vegetables, like the image on one side of the screen, and fewer hearty monster thick burgers, shown on the other side. And in my talk this afternoon, I'm going to examine the role of the food movement in helping to influence those choices. Many of us in the room consider ourselves participants in the food movement, and others study the movement, and still others interact with it in other ways. My hope is that my talk and this meeting can help us to engage in vigorous dialogue. And the goal of that dialogue is to figure out what we can do.
Oh, you've got it's some technical difficulties, I'm sorry, because we don't see. It's on his screen here, but not up there.
Great, thank you. So the goal of the dialogue is to figure out what we can do tomorrow and next year and over the next decade to be able to do something about the problems we've talked about. Some of the questions I'll consider will maybe appear on this screen soon. And my starting point is that from a health perspective, our food system is broken. I agree with Eric. From the point of view of the 1%, it's working very well. But from the perspective of health, it's clearly broken. And I want us to consider how that happened and what we can do together to transform our food system from one that now produces diet-related diseases and hunger and food insecurity, both here in the United States and around the world, to a system that produces health without threatening the future of our planet. And let's look at some data to get started on the magnitude of the problem. These graphs showing US data indicate dramatic increases in both the prevalence and the number of people with diabetes in the United States over the last 20 years or so, a change precipitated in large part by changes in diets and food environments. The graph on your right shows the increase in food insecurity in the US in the last 15 years or so. Note that even after the 2008 recession ended, supposedly, food insecurity has remained high, indicating that our current high levels of food insecurity can't be attributed solely to the economic crisis. The latest studies show that about 2.1 billion people in the world are overweight or obese, and almost 1 billion people go to bed hungry, as we've heard before. How can it be that at a time when there is more global wealth than at any prior time in human history, when science and technology have given us a better understanding of how to grow food and what human needs for nutrition are, and when we are growing more food than ever before, we have so many people at risk of premature death from diet-related disease or suffering from hunger or food insecurity? And I would say the causes of our problems come from human biology, social organization, and some economic problems. And minute here. On the human biology side, we humans evolved in a time of scarcity. And so we were hardwired to crave sugar, fat, and salt. And in those early days, stoking up on sugar, fat, and salt when you found it conferred evolutionary survival. But today, when the global food industry has put these products within arm's reach of almost every individual in the world, what used to confer survival benefits now puts us at risk of premature death. And what the food industry has done is make these products available everywhere. And the image on the far right shows the profit margins at Coca-Cola. And again, it's striking to me that at the very time that diabetes rates were doubling in the United States, and the strong evidence shows that sugary beverages played a very important role in that increase, Coca-Cola was able to maintain its profit margins. And I think that shows in a different way than in what Eric talked about this morning, is that what's good for business isn't necessarily good for health, and in fact can often be bad for health. And the argument I make in my book, Lethal But Legal, is that over the last 30 or 40 years, that corporations, large multinational corporations, have become the dominant influence on patterns of health and disease in the United States and around the world. And so today, the decisions that corporate managers and boards of directors and the people who finance them make have a bigger influence on health than those of health officials or doctors or hospitals. And that happens because the business practices of corporations, how they design their products, how they advertise them, how they distribute them, what the pricing structure is, and their political practices, the lobbying and campaign contributions, are the pathways by which people become at risk of chronic diseases related especially to food, alcohol, and tobacco, according to the World Health Organization, and also to injuries related to automobiles, firearms, and alcohol. And so if we want to understand how to achieve our health goals as a nation, we need to understand something about business practices. And this illustrates what I call the corporate consumption complex. And I make the case that beginning in the 1970s, a new power, the corporate consumption complex, emerged to dominate our politics and our economy. I modify the term from Dwight Eisenhower's 1961 warning about the military-industrial complex, which he said posed a threat to our democracy and our national well-being. The corporate consumption complex is that network of consumer corporations, that's the spider in the middle, their trade associations, the banks and hedge funds that finance them, the law, advertising, and public relations firms that promote their goals, and the scientists, politicians, and journalists they hire to advance their political objectives. To bring about changes in our health and our food system, we need to understand the corporate consumption complex and how it works. And in my view, the corporate food regime that we talked about this morning is one part of the corporate consumption complex, and there are other parts of it that also have a very important influence on health and well-being. And the corporate consumption complex arose in response to both domestic and international changes. On the domestic side, it was the growth of the consumer protection movement, the environmental movement, the women's movement, that put pressure on the food industry and many other industries to change their practices. And in the 60s and 70s, Congress passed and Republican and Democratic presidents signed 49 pieces of legislation that really changed how corporations operated. And in part, in response to those changes, corporations mobilized for a counter-assault. And that strategy is well laid out in the so-called Powell memo that Lewis Powell wrote to his friend at the US Chamber of Commerce. And he said, look, guys, we're losing control, and we need to be much more aggressive. We need to take back political power. And over the next decades, they were remarkably successful in doing that. Lewis Powell went on to be appointed to the Supreme Court by Richard Nixon and played his role there in creating the framework that allowed corporations to advance their business and political goals. And there were also changes in the world economy, some of them listed here, that for one thing, American corporations had to compete with corporations in Europe and Asia and other places. And there became what some people have called a race to the bottom, and a much sharper focus on short-termism, on returning profits to shareholders in each quarter or in each year, rather than the longer-term perspective that gave some benefit to keeping your customers alive and to maintaining the well-being of the corporation and its relations to government. But when you think you might not be around in 4 years, it doesn't become very important to test products and make sure they're safe, or to worry about the long-term consequences, either for your business or for society. And I think each of these developments had a profound influence on our culture and our behavior, and I'll say a little bit more about that in the beginning. And we also saw in this same period the decline of what had been some of the bastions of democracy in earlier parts of our history: family, community, labor unions, churches, and these became increasingly replaced by corporate power. And the ideology of the corporate consumption complex is hyperconsumption. And I define that as encouraging health behaviors and lifestyles that contribute to premature death and preventable illnesses. Hardee's Monster Thick Burger, which they call Audacity in a Bun, is a jumbo-sized cheeseburger smothered in strips of steak, has 1,420 calories and 107 grams of fat. Hardee's rapidly moved from lowest to highest ranked fast food restaurant among young male fast food customers, a very important demographic for the fast food industry. And its stock rose about 8% over the next year after it introduced the thick burger. Its chief executive told a reporter that the company's latest sandwich was not a burger for tree huggers. There are a lot of those here in Vermont. This is a burger for young, hungry guys who want a really big, delicious, juicy, decadent burger. I hope our competitors keep promoting these healthy products, he said, and we'll keep promoting our big, juicy, delicious burgers. But what's good for business is often bad for health. Hardee's returned to profitability, but at the expense of the cardiovascular well-being of a demographic already at high risk for cardiovascular disease. And the example that Roz gave us yesterday about the growth of palm oil provides another example. And we heard about some of the environmental consequences of palm oil. And another reason for the growth of palm oil is that it contributes to shelf-stable processed food. And it replaced, in many places, trans fat, an even more dangerous product. And so with our success in banning trans fat, palm oil became an important ingredient for the processed food industry. And palm oil is much worse for heart health than other oils like olive oil and canola oil. But it brings a higher return on investment. And the reason it has expanded is because the capital was available, because investors figured they could make a profit, a bigger profit on palm oil, which threatens the environment and health, than on other products available. The corporate consumption complex has developed an ideology to enlist support from both business and political elites and ordinary people for its economic and political agenda of promoting consumption as the only feasible path for economic prosperity. And what may strike some of you is how reasonable and self-evident the ideology's tenets listed up here are. And one indicator, even when we know that its grounding in truth is pretty limited. One indicator of the power is that so many people endorse the prescription of hyperconsumption, even though I would guess almost everyone in this room has some family member who's succumbed to diet-related disease or tobacco-related diseases or to the other products of hyperconsumption. And we've seen how terrible those diseases are, the suffering they impose, the hardship on individuals and families. And despite that, hyperconsumption remains the prevailing ideology in our society. Talk about the power to win over people's minds. To reduce the influence of the complex in causing premature death and preventable illness will require tackling the foundations of its ideology. And to replace the ideology of hyperconsumption and its burden of premature death, we'll need to create a new ideology of health. And to do this, we need to overcome Maggie Thatcher's dictum that there is no alternative to modern capitalism. But while new ideas are essential, and I think one of the very exciting things about these 2 days is we're talking about new ideas and grappling with those ideas and debating with others about how we believe them. Ideas alone will not change the world. To do that, we need a movement. And the reason that I'm optimistic is if we look at the history of this country, every other age has been able to bring together a movement to take on the challenges to well-being. In the early part of the 20th century, it was the progressive movement that created the Food and Drug Administration, that ended child labor, that created worker safety and health programs. A few years ago, the US CDC published an article on the 10 great advances of public health in the 20th century. 7 of those 10 involved changing corporate practices to better protect public health. What we need to do is to find the path for the 21st century. I want to talk about some of the dilemmas that the food movement faces. Michael Pollan has called the food movement in the United States a lumpy tent, a hodgepodge of organizations and beliefs. No one can or should tell the food movement what to think or do. But if we want to achieve more transformative victories, we'll need to find some more consistent common ground in what we say and do. I want to highlight 6 dilemmas that sometimes divide the food movement here in the United States. My goal is to encourage dialogue amongst us so that we can make progress in becoming a more coherent and powerful movement. And I'll discuss each one briefly. The first is the debate between food insecurity and obesity. Food advocates debate about which is more important and which should be the focus of our work. But in my view, food insecurity and diet-related diseases are 2 sides of the same coin, a food economy that is unable to meet human needs. How can we better integrate our work to these 2 dimensions of food problems? This shows the minimum wage and the value of the dollar. And you can see that the minimum wage, the value of the minimum wage has fallen dramatically. Most fundamentally, in this country, both food insecurity and diet-related diseases are symptoms of poverty and income inequality. I know it sounds naively simplistic, but in fact, the solution to eradicating both is eradicating poverty, a goal that was first articulated in the 60s, but abandoned when some people realized that ending poverty might mean asking the wealthy and corporations to pay their fair share of taxes. In the shorter term, current efforts to increase the minimum wage, to make procurement policies and school and other institutional foods healthier, and to switch public subsidies from unhealthy to healthier foods can be the transitional steps in helping to reduce both food insecurity and diet-related diseases. Anything that gives low-income Americans more money in their pocket allows them to use those additional resources for more food and for healthier food. And there are a variety of studies that show when people have more discretionary income that one of the first things they'll use it on is healthier food. The second dilemma is between promoting access to healthy food and restricting the promotion and availability of unhealthy food. And for a variety of reasons, the food movement has found it easier to advocating for making healthy food more available than to encourage less promotion and availability of unhealthy food. It's more appealing to increase access to fruits and vegetables and reducing than it is to reduce access to unhealthy food, because that requires taking on the food industry, now one of the most powerful players in American politics, with incredible power to veto policy proposals that they don't like. But many of us working on reducing obesity and diet-related disease believe we'll not be able to significantly lower body mass indices without reducing the ubiquity of high-fat, sugar, and salt foods. How can we do this? How can we better find an appropriate balance between these two important goals? So at my university, City University of New York, we sponsored a contest encouraging students to design visual images that we could use for a counter-advertising campaign against sugary beverages, which play such an important role in obesity. And this was one of the winners, which we then displayed around the campus. And we also need, in tobacco, we learned that counter-advertising campaigns played a very important role. The Truth Campaign, a social media campaign that aimed at rebellious teens, was much more effective in reducing smoking use by giving out the message the tobacco industry is trying to manipulate you in order to make a profit than the warnings that smoking was bad for them. Any of us who have kids knows that telling a teen not to do something is the best way to get them to do it. But telling them they're a chump is, by following the tobacco industry, is a very different kind of message, and it turned out to be more effective. We need to find out ways to apply that to food. Many municipalities and states are also exploring ways to look at zoning laws as a way of restricting the number of unhealthy food outlets, and also creating openings for healthier outlets because that density of fast food outlets can go down. Another debate is between education and policy change. And of course we need both to change individuals through education and laws and policies through political mobilization. How do we find the right balance? How do we avoid the American illusion that all problems can be solved by more information and education? One way, I think, is to combine the two, to use education to help people understand politics and power so they can act. The process that the Brazilian educator Paulo Freire has called pedagogy for liberation. And we also can change laws to mandate nutrition, consumer, and other forms of education that will enable people to participate more fully in making decisions. And I think increasing democracy is a very important solution to fixing food system problems. A third debate that I think has come up a lot in the sessions yesterday and today: how do we balance our commitment to a healthier food system and to public health with our commitment to social justice? And our movement mostly about reducing food insecurity and diet-related diseases, worthy goals in themselves, or is it part of a larger movement that strives to end inequality and promote democracy? What's the potential for each of these approaches and the limitations? Can the food movement expand its commitment to social justice in order to better achieve its own goals? These are the questions I think we need to be asking. In any particular campaign, we can differ about the most appropriate tactical decisions, and we urgently need to talk about how to frame the choice in a way that invites more people into our movement rather than driving them away. But in my view, promoting both public health and social justice are fundamental goals for the food movement. And part of that is because as a food movement, I believe, and I will be interested in the discussion period to hear what you think, that we will not accumulate the power we need to bring about transformative changes in our food system. We'll need to ally with other movements. And these are some of the movements that I think we can turn to. And each of these movements has important messages that have a direct influence on food and food systems. And each of them will magnify our power and our political clout and our ability to make a difference. So the questions are, how can we engage these different movements, and where is the common ground, and where do we differ? If the food movement wants to bring about transformative change, then we'll need to figure out ways to find a common agenda with some of these other movements. Yet another dilemma that we need to talk about is between local and national action, or between local, regional, national, and global action. On one side, you see a town meeting in Montgomery, Vermont. On the other side, the Poor People's March in Washington, D.C. in 1968, a very important mobilization that helped to change, at least for a time, poverty policy, and therefore the ability of people to have enough to get food and health care and other things. What's the best level for achieving each? I don't think we can answer that question in the abstract. It requires concrete analysis. And if we can figure out ways to better link global, local, and national action, and I share the concern of some of the people this morning about the worrying about falling into the local trap, thinking that local is an end in itself rather than a means to the end. And I worry whether we're in Monterey or Lima or North Carolina or Burlington or New York City, that our local action has the unintentional risk of improving things for the better off and putting the poor at worse nutritional status. And so the consequence is that we exacerbate those already glaring inequities in food access and health. And I think we need to be very careful to make sure that our actions don't have that consequence. And I think the national movements around the Farm Bill in the last few cycles and the Community Nutrition Reauthorization Act are good examples of the kind of vertical integration, bringing together local folks and state folks and national folks to focus on a goal and getting the strengths of each of those levels of action. And the final dilemma I want to talk about, which I think is really at the heart of the question the food movement needs to be thinking about, is between individual choice and community choice. A successful food movement has to be able to reframe the debates around choice and individual behavior. The corporate consumption complex argues that the individual choice of what to consume is the highest American value, and that any public intrusion on that choice compromises our liberty. But that's not the only way to think about choice. Amartya Sen, the Indian philosopher and political theorist, says that freedom is what allows people to fully develop their capabilities. And he describes good freedoms that enable people to develop those capabilities, and is willing to say that some freedoms don't lead to a good end if they undermine people's ability to make those choices. And I think for the food movement, we really need to challenge the corporate consumption complex's belief that any choice is good, and that our goal is to maximize individual choice. And we instead need to be asking about what choices are best made at the individual level, what choices at the community level, and what at the national and global level. And what are the rules for making those choices, and what are ordinary people's voice in shaping those rules? People have talked about America's two languages, the first language of individual freedom and choice, and the second language of collective action and solidarity. And both those languages are deeply rooted in American history. And the food movement has to get better at translating between those two languages and moving people from the first language to the second language, a language that has many more opportunities for mobilizing people and building power to confront corporate power. And these are just, I think, some examples of the types of choices, some of which are now framed only as individual choices that could be posed as community choices or social choices. And finally, I think we need to reject that dictum of Maggie Thatcher that there is no alternative, and we instead have to insist that another world is possible. That is really the core message that the food movement, the food justice movement, the food sovereignty movement has to bring to the world, that another world is possible. In his novel, The Magician's Nephew, C.S. Lewis wrote, "One moment there had been nothing but darkness. Next moment, 1,000 points of light leaped out. Today, thousands of organizations, millions of individuals around the world are lighting up the many paths that can lead to an end to the corporate practices that promote hunger, hyperconsumption, premature death, preventable illnesses, and injuries. We don't know yet which paths are dead ends and which will lead us to the transformative tipping points that will show that another world is possible. But what we do know is that business as usual will ensure growing health burdens, increasing inequality, rising environmental damage, and deteriorating democracy. Will our society grasp its opportunity to chart a different future? The choice is ours. Thank you very much.
Thank you, Nick, so much for that wonderful reflection on the issues and bringing health into the food industry. So we have about 15 minutes for questions. And we have microphones on several places that you can ask a question.
Still Craig Harris from Michigan State University. I wanted to pick up on the material you cited from Sen, that some freedoms undermine, and I can't remember exactly the quotation, some freedoms undermine our capability to live the kinds of lives we have reason to value. It seems to me that part of the problem is convincing consumers, some consumers, that they should not value a life composed of consumption of these items. Any thoughts on that?
Yes, and I think we really need to deconstruct, to look very critically, what do people want and why do they want those things? And I think any alternative to hyperconsumption that requires people to give up something isn't going to succeed. But I think if we look at some of the products the food industry or the automobile industry has put out, it's not like those are what people want. It's that those have been put on offer because they bring a good return on investment. If I can go outside of food for a moment to give an example, sports utility vehicles. It's not like Americans were demanding sports utility vehicles in the 1970s and 80s. Rather, the automobile industry discovered the profit level was 10 to 12 times higher on SUVs than on other vehicles. So they aggressively promoted them, spent $9 billion in advertising, made people think they were safer when in fact they put them at risk and were more polluting. And so because they were an offer and because they were deeply discounted, people bought them. I think if you look at many of the 60,000 or so products in our supermarkets, we see that same thing. But I think there's another factor that we need to consider, that part of the appeal of what some people call hyperpalatable foods, those foods that are blended fat, sugar, salt, appealing to our evolutionary instincts to stoke up, help to relieve the stress of our modern day society, the stresses that come from inequality and high-paced lives. And I think we as a food movement need to be creating alternative ways to help people respond to and lower that stress. So those are some of the things. And I think we need to think about what's a different kind of lifestyle and how do we promote it. And I think many of the movements, the women's movement, the youth movement, have explored with creating different kinds of lifestyles. They're often co-opted and appropriated by corporations, and we need to think of ways of holding on to them and resisting that. I hope that speaks to your question.
Thank you.
Go ahead.
Hi, my name is Delana, and thank you. I just wanted to say it was a great list, and I appreciate the outline of dilemmas with some strategies. It was really helpful. For my work as an activist, I just wanted to take it a step further and ask if you could give some specific examples of who you think is doing a good job organizing around some of these things, organizations or anybody specifically. It's always helpful. Thanks.
Yes. So I'll first talk about how impressed I've been by what I've learned about the Vermont food movement and the ability to work at many different levels and bring people together. But I'll talk about something I know a little better, which is the Brooklyn Food Coalition, which is a network of many community-based organizations in Brooklyn. In their first meeting in 2009, they brought together for the Brooklyn Food Forum 3,000 people from around Brooklyn. And at their meeting last year, they brought together 6,000 people. And it included Black and Latino community organizations of parents concerned about school food, urban farmers, Black, white, and Latino who wanted to get their hands in the dirt, groups concerned about the lack of access to healthy foods in their own communities, increasingly food worker organizations. And so I think that kind of neighborhood organizing, which also connects with some of the national food movements around justice for food workers, better school food, a fair farm bill. I'm very impressed by that work, and I know that's going on in a lot of places around the country. I'm very optimistic about the food movement and its ability to grow from what we heard described as a transitional movement into a transformative movement. It'll take time. There'll be a lot of fighting in that lumpy tent for us to get there, but I'm optimistic.
Spence Putnam from Weybridge. Americans react very well to crisis, and they can get mobilized to do something when they perceive a crisis. I think one of the things about the crisis that you've outlined for us is that it's obvious to those of us in this room, but it's not widely perceived in society, I think. And I'm wondering if you have ideas for people that are part of the food movement to make this crisis real enough so that the food industry will pay attention. Do you have some ideas for specific steps that we can take? I mean, I was struck, for example, you talked about the difference between local action and corporate action. Well, we take great pride in the things that we do locally. How do we translate that to a wider audience?
Great questions. Thank you, Spence. So I will outline a few different types of answers. So I see three crises, and I think it's the intersection of those crises that provides the opportunity. The first, which I come to from my own discipline, is a public health crisis. It's the rising burden of chronic diseases, which now 49% of Americans have one or more chronic diseases. And around the globe, chronic diseases are rising everywhere. They put a burden on the poorest families, on productivity, on the ability of people to work. They put a burden on our healthcare system. They put a burden on taxpayers. That burden will overwhelm our healthcare system. if we aren't able to move to preventive strategies. And the way to prevent chronic diseases, I believe, the surest way to prevent chronic diseases in the middle and long term is by changing the practices of the food, alcohol, tobacco industries that are the primary determinants. The second crisis is the environmental crisis, and I know you in Vermont and many people have been confronting this. Climate change, but also environmental degradation, and we need to find ways of bringing that alive. Many more people today are aware of and concerned about the environmental crisis. And in New York, Tropical Storm Sandy was a wake-up call for us, and I'm afraid there will be similar such wake-up calls around the country and around the world. And the third crisis is one of democracy and inequality. And I think the ephemeral success of Occupy Wall Street in capturing people's attention and calling attention to the 1% and the 99%, the ability in my city of a mayor running an inequality to be able to win an election, the success in intellectual circuits, a Freudian slip there, sorry, of Thomas Piketty's book, means people are interested about the political economy and inequality. So I think it's those three crises, and to the extent the food movement can pull those together is really important. I think bringing together global, local, and national action is really important. I've recently, in my role in the New York City Food Policy Center, been thinking about a lot what's the public sector in food, and how can we grow that sector? And I think creating public sectors in food that are an alternative to big food and industrial agriculture and industrial food is a really important step. It's a way of mobilizing communities and cities. In New York, we spend about $600 million a year on institutional food in schools, hospitals, jails, daycare centers, senior citizen centers. We spend another couple $2 billion a year on SNAP and WIC benefits. How could we be using that money better to achieve health goals instead of market goals? And I would ask, do you in Burlington know how many dollars your city, state, and government are spending on food in this town? And if not, I hope when I come back next year you'll be able to tell me, and then tell me how you could better spend that money to achieve better goals. Those are some first thoughts.
We'll let you go first because you've been standing, and then Jane.
Yes, thank you for your comments. They were terrific. My name is Mary Dale DeBorn from New Haven, Connecticut. I wonder if you could comment on how you see the role of a hospital sector, the healthcare sector, and providers in contributing to these changes, and if you have any specific examples of any such contributions that are currently being made.
Yes, I think they're good examples of the transitional changes, and I have a few thoughts on the more transformational ones. The transitional changes is a number of hospitals in Philadelphia, New York, and elsewhere are becoming places for farmers markets and a local food economy, and they're trying to encourage people who are coming for diabetes will stop in front of the hospital and get some fruits and vegetables. And there even is a movement of prescriptions for food, something developed in Mississippi in the civil rights movement in the 1960s, where doctors are prescribing food and trying to get the healthcare system to pay for that, because food is clearly the antidote to malnutrition or diet-related diseases. Many hospitals still have McDonald's in the hospital, and some doctors' organizations have begun campaigns to evict McDonald's and other fast food from hospitals. I think that's an important educational movement. I also think the climate change movement has been using corporate responsibility and shareholder action as one strategy among many. And I think the food movement and the health movement need to be thinking about how can we get universities and their endowment fund, the hospitals and their endowment fund, the organizations that hold our pensions, to say we're not going to invest in companies that make money by contributing to premature death. I think that will be a while till we're successful in that, but if we want to see that come to fruition, we'll need to start on that now. So I'd encourage people working in institutions to start thinking about how we could move on that.
Thank you for those examples. And actually at Fletcher Allen, which is the largest restaurant in Vermont, they have eliminated fried foods and others and have their own garden and are using a lot of local foods. So they've actually won awards for that reason. So thank you. Jane.
Jane Kolodinsky, Department of Community Development and Applied Economics and Center for Rural Studies here at UVM. I think that we forget about the consumer movement and the old-fashioned boycott and boycott. And in today's age of technology, you think back to the 70s when somehow individual consumers brought Nestle's down from their practices of selling infant formula in the developing world. We didn't have Twitter, we didn't have Facebook, we had none of that. So, we talk about who are the leaders and who can change this food movement. I'd just like to say I think it's individual consumers, and if you can get a flash mob to have a pillow fight in Grand Central Station, there's got to be a way to do a one-day boycott or boycott of something to at least get the attention of someone, and I'd like your comments on that.
Great suggestion. I have a short story that illustrates that point. Several years ago, I guess it was Kraft Nabisco, was selling in school programs a special packed version of Oreos that were particularly high in trans fat. And someone started both a lawsuit and an internet campaign. And Kraft Nabisco was so concerned that this campaign would go viral and would damage Oreo's vision that they took this product off the market within a week rather than challenging the lawsuit. I think that's one tiny victory. It's not a substitute for other strategies, but I think using the social media, using boycotts and boycotts are one part of an arsenal. And I think corporations are very concerned about their brand image, and that is really their great vulnerability. And the use of internet strategies gives us the power to threaten that very valuable commodity, and we ought to be thinking of smart, lasting ways to do it. My fear is that many of these are flashes in the pan, and so we need to think about how to build pressure and build power to make more substantial changes. But I agree it's an important strategy.
My follow-up to that is with the trans fat story, that was the quickest removal of anything from our food supply, and it was because of that lawsuit that trans fats disappeared overnight, and we were told they couldn't. Right?
Yes.
Okay, I see we have two more patient waiters, so Roz, I'll let you go, and then it's time for a break, but we'll do the last two questions. Go ahead.
Okay, this is a quick question. Great talk, Nick. I really enjoyed it. And I just wanted to reflect again on that irony that the most food insecure are also the most obese, especially in this country, but you've seen it all over the world as well. But in the U.S., I'm wondering about the educational component of this. And there are cheaper ways to get nutrition, buying a bag of lentils and a bag of rice that's not done even in the poorest households. And I'm wondering what your views are on whether we could ever get nutrition education back on the curriculum in public schools. I know there's a lot of individual schools, sounds like there's a lot in Vermont in particular, but a lot of individual schools have gardens and classes. But whether we could do this nationwide or whether that's just a political non-starter.
I think it's a very important point, and I'm a health educator by training and profession, and I'm very concerned that the primary educator of children and adults about food, alcohol, tobacco are the food, alcohol, and tobacco industry. And what kind of a society would turn over education of its children in health to those industries? So I think, yes, we need to do a much better job of doing health education in our school, education that develops people's critical thinking, and there are a lot of reasons why it isn't stronger than it is. Part of it has been the opposition by these industries to accurate school education. The other has been the emphasis on testing on basics, and it's one more victim of high-stakes testing. But I think in many jurisdictions, people are fighting for better education in the schools, and everything I've seen about nutrition education says that combining it with having children grow and cook food makes it that much more powerful. And so every school ought to have a garden, every school ought to have some for scratch cooking in a kitchen, and moving in that direction are important goals for a movement.
Okay, last question.
I'm Marty Strange. I teach in the Masters in Sustainable Food Systems program at Green Mountain College. I wanted to pick up on something you mentioned very briefly a few minutes ago about endowments. And that is one of the movements that you don't have on your list is the social investment, or responsible investment movement. And I think that's a very powerful potential ally here. And many of the people in this room manage their own portfolios and investments. It's not all in university endowments. Many of us have control over our 401ks or whatever. And it seems to me that we need to be looking at those portfolios in the way that you talked about. We had a classic case here in Vermont of a company, Green Mountain Coffee Roasters, which was a very socially responsible company for a long time. But it's just Coca-Cola has taken a 15% stake in it now, an equity position in it. And they're going to start doing for soft drinks what they did for coffee, make the individual coffee Keurig soft drink so you can pick your own poison. And I sold all mine, and I urge all of you to sell yours.
Thank you. And I agree the corporate social responsibility movement is an important ally. As in all the other things, nothing is a solution in itself, and each of these strategies, education, corporate responsibility, and particularly political organizing and mobilization, together will enable us to accumulate the power that will be needed to take on these very powerful forces. Thank you very much.